In psychiatry, what's interesting is that I think one of the major advancements of the last decade and a half, 2 decades, is that we're starting to really get a better understanding of the genetic architecture of a lot of psychiatric disorders like autism, like schizophrenia, like bipolar illness, where before we were grouping people together just based on phenomenology like it's done in the DSM. Now for the first time we're starting to get a sense that some disorders that we group together as being one disorder are maybe 2 separate disorders, whereas things that we conceptualize as 2 different disease entities may sometimes in fact be one and the same or different phenotypic endpoints of the same disease. My lab specifically works on advancing this cause, and we do that on 3 specific levels. The first level is that we do genetic studies just like the ones I just described, where we go out and meet with interesting subjects who suffer from a given disorder or who have a family who suffer from a given disorder. Sometimes we work with what are called founder populations, which are genetically isolated populations who have remained isolated for generations and therefore are genetically more homogeneous. One example is the Amish community in Pennsylvania that we work with. And what we do is we find individuals who suffer from disorders for which we have very little treatments available right now. Like autism, at the moment there's only 2 FDA-approved drugs available which do not really target the core symptoms of the disease. They are symptomatic treatments but don't really lead to improvement in the core symptoms and don't really improve quality of life all that much. So there's a dire need to get to a better understanding of the disease so we could come up with better treatments. So with our genetic studies, we try to screen those individuals and come up with genetic analyses that point us in the direction where the genetic mutation or mutations are that cause that particular disease. The second part of what our lab does is we take those findings from a given patient or a given family or a given population and then study that in different model systems. So we use mouse models, transgenic mouse models, where we create the mutation in the mouse and then study it, how it affects behavior and the brain structure and function, or stem cell models, where we introduce the mutation where the mutation is already there because we get cells from the patient's blood cells that we transform into neuronal cells, and then we study the function of those cells. And what that allows us to do, these model systems, is to really hone in on what the disease mechanism is for a given patient who has that particular mutation. We have one example now of where we actually took these sort of 3 steps and actually are now about to start a clinical trial. So we found a mutation about 15 years ago in individuals with schizophrenia and autism. Colleagues of ours found it also in an Amish subjects as well who live in Pennsylvania. And we then took that finding into a mouse model. We characterized those mice who were quite abnormal on molecular, synaptic, cellular, neurocircuitry, and behavioral levels. These mice were very abnormal, just sort of like the subjects who had the mutation. And we were able to sort of identify the molecular disease mechanism in those mice by looking for specific abnormalities in the neuronal function and structure. And then we were able to screen for a drug that specifically normalizes that abnormality, molecular abnormality in those mice. So we treated the mice with the drug. We treated them from birth onwards and the mice never got sick. Wow. And then we treated older mice with the drug and they reversed back to normal. So we couldn't really believe that finding at first, and we've spent many years trying to replicate it, and we were able to do that. So now we really believe and feel that this finding is actually very much real. And now we've learned that in the Amish community, it's actually such a common mutation that hundreds, if not several thousand patients have this mutation and suffer from mental illness. So now we have a drug that in our model systems has shown great potential, which is an FDA-approved drug for a different condition, which could be reappropriated and tried out potentially now for a disease like autism, where the alternative treatments that we have are not really making a big difference for these particular patients who are very treatment refractory, unfortunately.